Hello, my name is Dr Elly Hiby and I am the Director of the ICAM Coalition. This presentation is on the contribution of dog population management to rabies control, with particular emphasis on the Asia Pacific region. And it was delivered on July 17th, 2024 at the Asia Pacific Rabies Meeting, hosted by FAO, WHO and WOAH. I'm going to start with a very quick introduction to ICAM. We are a coalition of international charities. You'll see their logos at the top of the slide. And our mission is to support the development of humane and effective dog and cat population management globally. We publish joint guidance documents. Here are a selection of 3 of those. We run conferences and webinars. All the presentations from our 2024 conference that happened just a month ago are available on our website as videos. We host free online courses on DPM, and finally we also develop tools. One example here is Talea, which means count in Latin, which is an app designed for conducting street surveys of free-roaming dogs and cats. But before we address the contribution to rabies, I want to ensure that we have a shared understanding of DPM. So DPM is a permanent system of services or measures that are both working on the symptom of the current free-roaming dogs, mitigating risks and nuisance, but also working to address the cause by working out where these dogs came from in the first place and working to stem that source, which is very likely to include the owned dog population. When we look at the dog population as a whole, as this system of interconnected subpopulations, we can start to see all the population dynamic processes that need to be addressed. So when I say comprehensive DPM, I mean the DPM services match the dynamics that are a priority in that population. And population dynamics differ not just between countries, but between communities within countries, varying between urban and rural, and communities with different religious and economic backgrounds. So if loss and failure to reunite owned dogs is a significant source of free-roaming dogs, then we want to introduce identification and registration. If we find evidence of impulse acquisition or the sale of puppies with poor health and behaviour leading to subsequent abandonment, then we need controls on commercial breeding and sale. But of course, the most persistent dynamic process will be birth, and specifically for population management, unwanted births. Our goal is not to eliminate the entire dog population, it's to create balance in the number and type of dogs that are born with what is wanted and manageable. Many countries do invest in systems for reuniting and rehoming. This measure can be effective if there's a realistic chance of rehoming the dogs and if there are funds available to run these to a reasonable standard. The example in the photo is Soy Dog Foundation in Phuket. But without the ability to build a widespread practice of rehoming, shelters become sanctuaries where dogs live out their lives, so they quickly fill to capacity and cannot take in new dogs. So they're no longer functional in terms of managing the new free-roaming or unwanted dogs. And without sufficient funding, the welfare standards can become very poor indeed. In both cases, the financial resources required are sizable. Catch, neuter, vaccinate and return, CNVR, also known as ABC or animal birth control, is an option for managing free-roaming dogs in situ on the streets, hence an alternative for shelters, steadily bringing their population down in size and mitigating the risks and nuisance they may present to local communities. I'm conscious that was a high-speed run through DPM. We do have 2 texts that cover this subject in more detail. Firstly, Chapter 7.7 from WOAH's Terrestrial Animal Health Code, then ICAM's DPM guide that presents very similar concepts but goes into more implementation depth. And then also this free online course designed to be short and concise for policymakers, including references to the relevant articles of Chapter 7.7. And there's a more in-depth version that's for implementers. And you'll find links to both of those on our ICAM website. But now into this issue of DPM and rabies control. So we know we have 3 factors that we can influence with our interventions in order to bring R, the effective reproduction number, below 1 and as close to 0 as possible. And the faster we can do that, the faster to elimination of rabies from the dog population. So we are working with transmissibility, contact rates, and duration of infection of rabies in dogs. History has taught us that culling does not work. It has no effect on transmissibility, it doesn't change the duration of infection unless you are lucky enough to cull a dog that actually has rabies, which is actually unlikely when you consider how low the incidence rate is. It's also difficult to spot rabies in the early stages of the disease, and so the vast majority of dogs culled will be healthy. And it either has no impact on contact rates or very transient. The mechanism for this failure to impact contact rates is kind of interesting in itself. So dogs are social species. Even if you manage to cull half the dogs in a population, which really does take some effort, they will travel that extra distance to interact. And immediately following culls, the perturbation of the social structure may actually lead to an increase in contact rates. The behaviour of a dog with rabies symptoms is also relevant. Some will be capable of moving quite some distance before the disease takes over and they die. And then we also have a remarkable ability for the dog population to replenish its numbers after culls. And together, this leads to the finding that rabies is independent of dog density. It persists with a fairly consistent R0 across a wide range of densities. If dogs aren't culled, but instead removed to live out their lives in sanctuaries, we have the same ineffectiveness. Now, there is an important ethical difference in these 2 approaches, but in terms of disease transmission for the remaining free-roaming dogs, they're actually the same. We also see that culling is counterproductive. When used following a vaccination campaign of free-roaming dogs, it's often the dogs that were catchable for vaccination that are also catchable for culling. And where owned dogs are caught up in the culls, we find people will move their dogs to avoid culling teams. And that's what seeded rabies across the island of Bali in the early days of their outbreak. And owners are likely to disengage with rabies control activities, running the risk of reducing vaccination coverage of owned animals. Conversely, we know that vaccination is effective, reducing transmissibility and duration of infection. In fact, bringing the time of infectiousness down to 0 because the dog's immune system kills the rabies virus without the virus ever having the opportunity to infect another animal or person. And it enjoys widespread community support. When it comes to DPM, the lack of density dependence also applies. Now, DPM does reduce dog density, and fewer free-roaming dogs leads to a number of positive impacts. We are today in a city, Bangkok, that has seen a decline in free-roaming dog density by 54% over the last 7 years, using CNVR implemented by Soy Dog Foundation, funded by Dogs Trust Worldwide, and combined with other DPM services run by local and national governments. With an associated improvement in dog welfare and, via a recent CAP survey, Bangkok citizens reported a reduction in nuisance behaviours and a reduction in bites. There has also been a reduction in rabies cases, but this is not due to the change in density. Instead, the contribution of DPM to rabies control is through supporting the intervention of dog vaccination. The principal mechanism by which it does this is by reducing turnover. So in this graph, we see the proportion of vaccinated dogs rocket up during an annual vaccination campaign and then reduce over the coming months as vaccinated dogs die and susceptible puppies are born, before being boosted back up by the next annual vaccination campaign. In effect, what we can do with DPM is to make this fall in vaccination coverage more shallow, ensuring that it doesn't fall below that critical herd immunity, making our vaccination campaigns more effective. I also wanted to show you this line. Now, this is what can be achieved for a free-roaming dog population, not with annual mass vaccination, but with all year-round CMVR. You can bring the proportion of vaccinated and sterilised dogs up over a period of time, and if you keep maintaining your CMVR effort, you can keep the population at this level, well above the critical herd immunity. DPM should also increase access of dogs to vaccination, and in particular, those dogs that are epidemiologically relevant to rabies control. So, we know that free-roaming dogs are the most at risk of being involved in rabies transmission, but the likelihood that dogs will be vaccinated actually goes in the opposite direction. Dogs that are fully confined, owned and adult are more likely to turn up to vaccination campaigns, whilst free-roaming, unowned and puppies are underrepresented. But these are the dogs that are the focus of DPM, both because they are the target group for intervention and also because effective DPM will over time reduce the proportion of the population that is free-roaming, unowned and young, increasing the proportion of the population that is easily accessible for vaccination via owners or carers in the case of community dogs. So what does DPM that is supportive of rabies control look like? It should be working to create the ideal dog population for effective rabies control, where epidemiologically relevant dogs are accessed for vaccination, vaccinated dogs survive, and the birth of susceptible puppies is minimised. Going back to the mechanism of reducing population turnover, we want to protect our investment in the immunity of the vaccinated dogs. So quite simply, do not cull free-roaming dogs and don't remove them to either relocate or housing sanctuaries. I've worked in cities where the national rabies control interventions were creating good vaccination coverage, only to find city authorities removed those same vaccinated dogs just a few weeks later. So we need cohesion, synergy between national rabies control actions and DPM by local government. And we want to encourage basic care of these vaccinated dogs by increasing the perception of value in a vaccinated dog. Too often public awareness materials demonise dogs with photos of scary looking dogs, all teeth and saliva. The motivation for these is to encourage important health seeking behaviours, although I would like to challenge the effectiveness of such imagery, with many people just switching off rather than absorbing the bite treatment messages intended. We need to encourage the public to take action to vaccinate dogs and to care for them to protect our investment in their immunity. Actions that are more likely to be supported by images like these. Reproduction control is a core service of DPM, but as a limited resource, so we do need to use it wisely. Targeting dogs who are most likely to produce puppies that will remain unvaccinated. So community dogs are particularly relevant. They're free roaming, so at highest risk of transmission, and they're provided resources by the public, so puppy survival is good. And so sterilisation and vaccination of these dogs who catch, neuter, vaccinate and return can be a powerful part of building sustained herd immunity. But also consider those dogs that are owned by people who are most likely to find themselves overwhelmed. Like this lady that I met in the south of Thailand earlier this year when I was working with Dogs Trust and the Lanta Animal Welfare Association. We want every dog to have oversight by an owner or guardian that is willing and able to access rabies vaccination every year for all their dogs. When they have a couple of dogs, that may be feasible. But an unwanted litter can make that 8, and then the following year it's 14 dogs, and this lady had reached around 20. She isn't being irresponsible, she's overwhelmed, and the care provided to each individual dog drops off, including vaccination. Many of these owners know this could happen and are willing to invest in sterilisation if it was accessible. So we need to invest in veterinary training in sterilisation to ensure that sterilisation is safe, quick and more affordable, and invest in mobile clinics or transport services to increase access to clinics. It's also more efficient to focus on females. They are the limiting factor when it comes to puppy production. Finally, note that these are indeed the same dog populations that are most relevant to rabies transmission. One DPM service that needs to be used with care is regulations on dog ownership practices. If we bring in unnecessarily strict measures that are difficult to do and potentially unkind for the dogs, such as high registration costs or demands for chaining and caging at all times, we risk alienating the owners of those free-roaming dogs that would be so precious to vaccinate because of their usefulness as a buffer to rabies spread. If these regulations are not realistic, these dogs will either be abandoned or they will be hidden during those rare moments of enforcement, both of which make them less accessible for vaccination. Regulations need to have a clear outcome in mind, encouraging vaccination of all dogs, including those that free roam. The free roaming behaviour of dogs is actually not the problem for rabies control. It's unvaccinated dogs. What I've done so far is pull out those elements of DPM that are most relevant to use when we are working on rabies control. But I don't want to misrepresent DPM. It's not only for the purpose of rabies control. There is a significant overlap in terms of supporting vaccination coverage. But there are a suite of additional impacts achieved through effective and humane DPM. And this is a key point. People with a laser focus on rabies may ask, why can't I just stick to vaccination and ignore the costs and effort of DPM? And that absolutely is an option. But the reality is that DPM is wanted to achieve other objectives. In my experience working with local and national governments, rarely are their concerns purely on reducing rabies deaths. They want to see additional impacts. So for those of us with a focus on rabies control, we need to welcome the addition of DPM and ensure that it does indeed have synergy with our goal of sustained herd immunity. I've already mentioned some ways in which attempts to control the dog population can actually work in opposition, principally through removal of those vaccinated dogs that we rely on to build herd immunity and kill the rabies virus. But in this region of Southeast Asia, we do also need to consider one other very significant influence on dog population dynamics, and that is the dog meat trade. There are risks for the people involved in the capture, movement and slaughter of dogs and cats for meat. These are just two examples of reported human rabies deaths linked to the dog meat trade. But perhaps more concerning for those of us trying to establish an effective and sustained herd immunity is the movement of dogs with unknown vaccination and disease status, both within country and transboundary. I've included two examples here of the movement of dogs for the meat trade in Vietnam and Cambodia from this report by Four Paws. While it's impossible to quantify the exact number of animals involved due to the unregulated nature of the trade, it is of significant magnitude. Estimates for Cambodia are over 3 million dogs, in Indonesia over 1 million dogs, and in Vietnam over 5 million dogs and approximately 1 million cats are killed for the trade every year. Many of these will have been owned, some possibly vaccinated, and not all taken with owner's consent. And if we think back to what we want to achieve for rabies control, the meat trade obviously increases population turnover and hence works in opposition to our attempts to establish herd immunity, and obviously brings the risk of incursions and transmission to those involved in the trade. So in summary, DPM is a comprehensive and permanent system of services that mitigates the risks of the current free-roaming population, but it also works to stem the source of future free-roaming dogs. DPM has many impacts, including its contribution to rabies control, most clearly through its support of reaching and sustaining vaccination coverage, and not through its impact on dog density. But it also has many other beneficial impacts. So we find both stakeholders and funding for DPM that is in addition to that focused on rabies. Our job within the rabies community is to ensure those DPM efforts have synergy with what we are trying to do so that we can maximise the contribution and prevent practices that run in opposition. And when we look more widely at the dog population dynamics in Southeast Asia that affect rabies control, it's very clear that the dog meat trade is a threat to our success. Many thanks.